Thank you for being here today for our micro-teaching session on quality in healthcare. In this 5-minute session, we're going to look at the basic definitions of quality in a healthcare setting and within your professions, and then we're going to see how you can use that knowledge and that information to build a set of skills which will be of practical value to you in running a quality improvement project in your own workplace setting throughout the year and throughout the course. So if somebody said to you, how can you show that the healthcare that you're delivering hits a certain quality? That's a very big thing to try and look at in one go. So what we do, we divide it up into different dimensions, different areas. We've got the idea of safe, effective, patient-centered, efficient, timely, and equitable. And on these, it's a lot of words to throw at you in one go, but looking at the idea of safe. When we look at dimensions of healthcare quality, there's also a different way of phrasing them, which is thinking no needless. So if something is safe, then we've got no needless deaths. We can show that not everything will work, but actually if we're having no needless deaths, that particular aspect is safe. Is it effective? And then with effective, we're thinking about no needless pain or suffering. So the effectiveness of the particular item that we're doing is measured in having no needless pain or suffering. We'll look at, is it patient-centered? So it's everything we're doing focused on the particular needs of that particular patient and that particular patient group. We'll also look at efficiency. So in efficiency, is there no needless waste? And that could be no needless waste of resources, or also it can be looking at environmental sustainability and carbon footprint. Then we also look at the idea of timeliness. Is there no needless waiting? If you're going for a procedure, then what you want to do is have that in a timely manner that's effective and efficient for you, but also that's going to be effective and efficient for managing that particular condition. And then the final one of the dimensions we've looked at is equitable. No needless discrimination, no needless changes to protocols for different patients for different treatments, everybody not being treated the same, but everybody being treated in the way that is equal for them and their particular health needs and their particular groups. So again, that's a lot of definitions in one go, and you're probably thinking, how can I use this in my own workplace setting? So let's think of a very simple example. You may have had a patient comment or perhaps even a complaint in your own workplace setting that all of the patient information leaflets in your setting are all done in a font of about size 12. Now that might be okay for some of us to read. For lots of people, that's simply too small. If somebody has a visual impairment, if somebody hasn't brought their glasses with them today, then that can be very difficult to read. So what you want to do is think about that equitable aspect of what you're delivering. Is it equitable to have that small font size in there, or do you want to make it more equitable by having a range of font sizes? So bigger font sizes for people who've forgotten their glasses or who may have a visual impairment. And in quality improvement, that's what you're doing. You're looking at a particular dimension of healthcare quality and not thinking, how can I change the world in one go? Because that's never going to happen. What you're thinking about, how I can be focused in this particular aspect, look at one dimension of healthcare quality, somehow measure that, and then see what we're hitting against. So for our patient information leaflets, we would think, what percentage of our patient information leaflets are currently in an accessible format? And we think actually, we've looked and we've seen that 2 out of our 10 leaflets have a small font size plus a larger font size. 2 out of our 10 are compliant, 20%. How many should be compliant? Well, ideally, 100% of our information leaflets should be compliant. So we're thinking 100% of our information leaflets need to be changed, and that's what we're going to measure. So we're going to measure at the start 20%. We're going to put something in place to get new informational leaflets in there with a larger font size. We're going to remeasure and see, are we hitting 100%? We're looking at a particular aspect of healthcare quality, and then we're measuring this, we're setting a bar, and then we're remeasuring. So to recap, quality is a very big word. When you're looking at quality in healthcare settings, there are certain aspects that you're going to be looking at step by step. You're going to focus in on one of these, and that's what you're going to work on with your quality improvement project throughout the year. Thank you.